Hey guys, good evening and welcome to another evening of Community Conversations with Councilwoman Tameika Isaac Devine. I am Tameika Isaac Devine and thank you so much for tuning in. For those of you who this might be your first time joining us, I hope it is not your last time. Community Conversations is just something kind of grew out of everybody being home during coronavirus. When everybody was home and, in quarantine, there were still a lot of community conversations that we needed to have. And as an elected official, I like to be out and about, talking to folks, figuring out what are you thinking, what are you feeling, what are some of the issues that are pressing on your heart. And so I decided to start doing that virtually. And so that's where we started community conversations. It started around coronavirus and things that we all needed to know. But it has expanded because there's still so many community issues that we need to have conversations about. So I'm excited to have been able to keep this going and to keep you guys informed and enlightened as we make sure that we're informed, but also that we take some action out of what we learn. And so this week, I am so honored to have a new acquaintance. Hey, Sandra, good to see you. Thank you for bringing that to my attention. And so if you are here, please go ahead and put your name in the chat, say hello so that I and Dr. Bryant know you're here and even where you're coming from. Hey, Dr. Sonia Lewis, good to see you. But excited to have you guys here. And then those of you who are watching the replay, go ahead and hashtag replay for me. And then go ahead and share this broadcast as well so that more people can get this information. But I'm super excited because tonight I have a new friend of mine. But I know that based on our limited interactions so far, we are going to be good friends because I really am inspired by her passion and her dedication for making the state better. And y'all know that's what motivates me. That's what drives me, is my passion to always be trying to make sure we're doing better. And so tonight, I'm very pleased to introduce those of you who don't know her, Dr. Debbie Bryant, who is a healthcare professional, but she is also a candidate for the South Carolina State Senate. We currently only have 2 African-American females in state Senate. Shout out to my good friend, Mia McLeod, who tomorrow's her birthday. Yay, Mia, happy pre-birthday. And my good friend, oh gosh, I'm about to say my good friend, and then I was about to say attorney because I know her from being an attorney, but I've got oh gosh, why am I've been in court all day. Margie Bright Matthews. Margie represents Walterboro, well, the Colleton County area, which is where my mom grew up. So anyway, so shout out to those women and the other dynamic women who are in the Senate. We've got Senator Katrina Shealy, and there's one more because there are 4, aren't there?
Yeah, there are 4.
There's just one more. But anyway, but we're excited at the possibility, the probability of us having one more. And so, Debbie, if you would just introduce yourself to our guest tonight.
I will, but let me first stop and say thank you for inviting me and to have a conversation with you. When we first met and talked, the conversation was this easy. So I know this will be the same in talking to you and your followers who come to this group. So I'm looking forward to it. So I am, yes, Dr. Debbie Chapman Bryant. It's not hyphenated, but I grew up in Moncks Corner, and people know my maiden name, so I tend to use it more than not. But it's not a hyphenated name.
And I'm the same. That's friend, why Tameika Isaac Devine. It's like you feel like that's been your name all your life. You
exactly.
Can't just leave it alone, right?
Can't just lose it, right? But sometimes my husband says that when somebody walks up to him and say, "Mr. Chapman." Do you have that? Does that happen to your husband?
They call him Mr. Isaac, and he'll just take it. He'll answer because he just knows I'm from Columbia, so everybody knew me as Tameika Isaac. When I first ran, I was still Tameika Isaac. We got married after I got elected, so he'll even answer. I'm like, I love you. You'll just take it. He'll be like, yeah, Mr. Isaac.
My husband is a retired military guy, so for him, he quickly corrects them that it's Mr. Bryant, not Mr. Jet. But anyway, so I am a nurse. I've been in nursing. Nursing was a second career for me, believe it or not. Most people are very shocked when they hear that. I did not go to nursing school until I was I was married and I had my first child by then. and decided that I had always had that calling to nursing. But you know, when I grew up, and I grew up in rural Moncks Corner, and I had that path of going from segregated to desegregated schools, and first on a voluntary basis. So didn't always have the uh, teachers who were giving you that impression that this was something that you could do. Now, of course, the community that I grew up in, and my mom and my mom and dad, they tried to do everything they could. But you know, there were tough times in there. I will admit to that. So nursing was a second career for me. I went back to nursing school after going to school at first and having that same kind of uh, defeat early, and you know, the not always the very positive self-image, but all that has changed for me. It is, you know, being a person then to accept and understand your journey, and being able to stand and strong where you are, and to be able to work very hard to show young people, little black girls, white girls, black boys, white boys, that if you want something and you want to do something, and that's your journey and your goal, that you can succeed. But of course, I want every little black girl to know that if that's what they want, that they have people like you and I there with them, right along with them, to help them with their success. So I started as an associate degree in nursing as well, and then continued my career into the bachelor's degree, then a master's degree, and then a doctorate in nursing practice. I am now an associate dean in the College of Nursing at the Medical University of South Carolina. I've spent most of my career in public health. I've done bedside nursing. I did ambulatory care. I did the hospital, you know, OR, PACU, all those things. But I found my voice when I came to community nursing. So I found the strength in helping people to stay well rather than caring for them as they were sick. And I also then found a passion for looking at the health of a population, a group of people at one time. So I ran prevention and control outreach department for the Hollings Cancer Center at the Medical University for a good part of my career, in design and implementation of projects and systems to help with cancer prevention and wellness prevention. Loved it. I can say for me, I have been blessed that I went to work every day feeling that I was in the place that God called me to be. And I know that oftentimes people don't have that, but I was lucky. I feel in my life that I got paid to do what I felt that I was supposed to do. It wasn't just a job. So that's kind of my career. I have two children. My children are my daughter's 21 and a senior at USC. I probably have to turn this fan off. And my son is 27. He's on his own working. So I won't say they're quite all grown yet. I mean, in number they're grown, but they still sometimes need some help from mom. But you will find that you love that as well, because you miss having little kids once they're gone. And I don't have any grandchildren yet. My husband have a couple of grandkids that I get to spend time with, but I haven't gotten to rock my very own grandbaby yet. So I look forward to that at some point. Not yet; they're not ready yet, but at some point, I look forward to that. Yep.
Well, that is cool. And Edna Brown is on saying hello, Edna, and thank you for joining us. And for those, we're going to jump really into our conversation. But if anybody has any questions for Dr. Bryant, please put them in the chat, and we will make sure that we get those out there. But let me just, excuse me, let me ask you first, starting Debbie. I mean, I love what you said about how you worked on wellness. Want to make sure that people are armed with the right information and the right tools to keep themselves well, instead of just in treating the sick. And that's really, I think, one of the problems with our healthcare system is that it really focuses on managing symptoms versus actually keeping people from having the symptoms and having the illnesses and ailments. And we know that South Carolina is one of the places that We tend to be high in everything bad and low in everything good. And
That's
when it
correct.
comes to health disparities, that is one of them. I mean, I represent the 29203 zip code here in Columbia, which is nationally ranked as one of the highest, if not the highest, zip code in the country for diabetes and amputees. And so we are constantly, just struggling on how do we keep people well, but not just keep them well, but arm them with the right information. And we know, and I think it's been highlighted a little bit more this year, but we know that it's not that we've got people who are not well because they just don't want to be well or they
Right.
don't know how to be well. But when you have food deserts, when you have a healthcare system that is broken, when you have folks who don't have primary care physicians, when you have intense poverty in certain areas. I mean, I can go on and on and on, but there's
Right.
so many
Living in a rural communities,
factors.
right. Access is a huge factor to
Yeah.
health disparities. Right. So
Yeah. So from your expertise in that medical field, what are some of the things that you think are really things that are highlighted to you as far as South Carolina and our overall wellness and our access to healthcare? And what are some of the things that you believe need to be done to address that?
sure. So I've spent like I said, the majority of my career talking and working on some of these same things. I've had the privilege of actually being invited to Washington twice to talk about some of the same things that we see in those rural communities around access and poverty around healthcare. So what I think is it starts from a perspective of knowing, um, like when we grew up, we knew that we had to go to school, right? You go to school, you come home to do your homework. That is ingrained in every part of you. And for most and your children, when they come home and they have problems with their homework, they know that they can go to mom. They know that they can go to dad. They know that they got maybe a big brother. Well, your little ones, they got a big brother or big sister. I'm sorry, I
Big
might get it.
sister. Yeah.
Sister that they can go to, and she will help them out with what is this word or whatever. So I think our healthcare systems need to work pretty much the same way. There needs to be a strategy and a structure that from the time of birth, we understand what preventive healthcare looks like, and we understand the path from birth to cradle to death, where those and I will call them pulses are, where 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 we hit that perspective. We know that our children need to get vaccinated. We know that they need to be at the doctor's office in the first 2 weeks, and then again and again and again, and what each of those milestones look like. If you remember, when your kids are little, every time you go in for a checkup, they give you that sheet of paper and say, okay, in the next, these are the things that you need to pay attention to. Well, at some point that falls off. It happens until a child is about, and I can't even remember. I'm not a pediatric nurse, so when they're done with that, those first set of vaccinations and those primary checkups, 9, 10, 12, whatever, and then it kind of stops, and we don't know that we need to be back in the doctor's office again until maybe as a woman we're now going in for our first OBGYN appointment, and you're hearing all those things that you hadn't heard in the pieces that we missed. Those need to continue, and it needs to continue within the entire scope of our adult life. What we need to have, what we need to see, what we need to be doing, because if we did that, we would catch those things early. Now, I'm not saying that is the fault of the person. There is some personal responsibility in it, but you have to know that that's a path that we need to take in order to take those responsibilities. We need to have that ingrained in us to understand that that's the path. And then we need to have the systems that are there to help us succeed at that. You can't tell people to go get a colonoscopy or do a diagnostic, a screening breast exam with mammogram or a prostate exam, or all the things that we hear that we're supposed to do, but there are no mechanisms and no systems to make sure that we can do those things. So how do we make that happen? If we, and this is what I was so excited when Obamacare came out, and we were shifting our dialogue and changing the conversation about treating illness to prevention. We were talking about what we needed to do for our own in our own personal responsibility world, but we were also talking about these are the preventive health measures we need as children, as adolescents, as young adults, and older adults. And here's how we're going to make sure that those things are available for you. And then, that system broke down. So I think we just need to go back into how to, again, develop those systems and structures for throughout our lifespan that we can put those back in for healthcare. And that means that you have to have access to healthcare. Rural folks in rural communities need to have access to healthcare. And we cannot, as you have said, we can't talk about eating healthy when the resources aren't there. We can't talk about exercising when we don't understand even what that means, and how that works to ensure that we retain health. So those things need to be put back in place. In South Carolina, we need a true healthcare system that works and serves everyone and access. And right now, that's the Obamacare or expansion of Medicaid. We can do it easily by just expanding Medicaid.
Yeah. So Dr. Lewis says, I served as an analyst at DHEC in the cancer division. Women of color are dying from breast and cervical cancer unnecessarily. It has been determined that this is due to lack of access and education. Yeah, it
Right.
is so important. And you know what? I mean, that's typically the elephant in the room is about the expansion of Medicaid.
Yes.
To me, it's the no-brainer, but it has become such a political issue. But clearly, states that have expanded Medicaid, you can see that they are being able to address all the issues that we have. Tell me, I guess, working in this field so long, what have you seen, especially in the last, I guess, whenever, our state decided not to expand Medicaid. So what are we at, 6 or 7 years now? What have you seen has happened to the healthcare system in South Carolina since that decision was made?
Totally broken down. We have done everything we can to dismantle some of the great work that was being put in place and the things that we saw that we were so excited about as healthcare system. As Dr.
Lewis
just said, when you think about it, education and access isn't hard. It really isn't. To be able to put systems in place to speak to those things aren't the hard thing to do. What's hard is when you say, we don't know what the system or the cure is for pancreatic cancer. We don't know. So yeah, people are going to die from that at this point. More people are going to die. But if we're getting better there. But to have women who are dying of cervical and ovarian and those cancers because they never knew, because they never got a cervical exam, those things are just unacceptable. So what's happening in our state when we try to put in all of these pseudo systems and we're doing this, we're doing that, we're piecemealing it rather than doing the system, having a systematic approach and expanding Medicare so that we can have the same health outcomes that we're seeing in other states. Also, I'm a nurse, so my colleagues who are nurse practitioners, to be able to arm them and arm systems in these rural communities, that's what we need to do. Putting dollars up front in healthcare and access up front in healthcare will even save us more money. That's what I don't think that we understand. If we were talking about what is economically sound, save lives, arm people with the information to help care for themselves, just let's add this on top of the system and stop the system where we're now trying to write more grants and find this dollars and serve this community and beg, borrow, and steal here. That's kind of how our healthcare system is working in the state now. And it's really time for us to just follow best practices that we see other places and become a state that can be on top rather than on bottom, as you said earlier.
Yeah.
It's not hard. Let's just do it.
Yeah, because I say this, everybody who's watching who's heard me say this before, but I always say, and I don't take ownership on this because I always say, I saw Don Lemon say this early on, but he said, coronavirus is the great equalizer in the fact that it doesn't discriminate on who can get it. I mean, rich, poor, celebrity, not celebrity, black, white, whatever, anybody can get it. But it is also the great magnifier in that it magnifies the things that were already existent in our society, as far as, financial hardships and economic instability of families, health disparities. I mean, it's just, it magnifies things that were already existent in our community. And one of the things that it wasn't, it's not hard to understand why communities of color, people of color, are more disparately impacted by coronavirus, because we tend to have those underlying health issues. And I say that all the time, that, I ain't no fool. I definitely don't want to get it, because if you look at it, I am obese. By the clinical definition, I'm obese. I have high blood pressure. I have a neurological disorder. So, I mean, I've got like lots of things that if I get it, the likelihood of me having not so great outcome is exacerbated. And so I would love to hear you, for someone who's worked in South Carolina, your medical career, and seen rural areas and stuff. I mean, what is your thoughts about just the health disparities and how our state, I guess I would say, has ignored it up until this point, that we still have such vast disparities as far as health outcomes for particularly communities of color?
Well, I think the answer to that is, and I don't want to say people don't care, right? I really don't think that's it. I believe that we don't have enough people who are lawmakers who understand the gravity of the situation and the issues the way many of us do. Also, it's different when you live something, right? My journey to what it took to become a nurse, what it took to become someone who people neglected or undermined in me as a person who could be educated. Meaning, I literally spent some years on a, they call it the short bus. I was identified as someone who couldn't learn early in my life or wouldn't learn. But that had nothing to do with my brain. That had to do with the color of my skin. So no one would understand that, and what it took for me to overcome that, to be able to say now I have a doctorate degree, other than people who have lived that journey. So when people who are making decisions about what healthcare needs to look like or schools need to look like, we need to have enough people who can say, well, wait a minute, now that's not going to work. And so again, I am not the person who is the firm believer that people don't care. We have a lot of people saying, you don't care, this person, this area, that, they don't care, white folks don't care, Republicans don't care. I frankly don't believe that. Now, of course, there's some mean people, period, right? That's just life. But I do think that we need people who you have to be able to speak from a point of knowledge. And what does that knowledge look like? You need some people who can understand it. We need people who can write it. We need people who can speak to it. We need people who understand the science, but we need those who have some lived experience as well. So I think that is one of the things that I see, that we don't have enough people with the lived experience making the laws, and they're making the laws for everyone when you don't even understand the problem the way it stands. So you're making laws based on just your perspective of it. So I think if we have to change that dynamic. And the reason I made it, one of the reasons I made this decision to run, I tell everybody as a nurse, do you really think that I thought that serving in a state office was what I was supposed to be doing? No, that wasn't it. But I started to understand when I was asked to advocate, I was going and trying to make a case for something, and you sit here and you say all these things and you make this case, and what you sometimes see on the other side is the pushback, because they want to understand it from the perspective that they think, well, this is how I've always seen it, rather than what they've heard from you. Well, now if I'm not the person who I'm not always there just speaking on it, rather than sitting at the table with you and saying, well, now wait a minute, you're making this law based on this piece of it. So together we have to come to a different understanding, because I'm going to want to make sure that the way I see it is written in the policies as well, right? So we can't just be the person that's advocating for policy change. We have to be someone who's making the change. So we need more people like us and like-minded, and women who understand it from a very different perspective. So that's what I think needs to change in South Carolina. We have just been doing things the same way for 40, 50 years, and we've expected different results. And people are saying it's too hard to be in office, right? Which I it's hard to run for office. I can say that. That's what I know so far. It's really hard to run for office. So
it is tough to serve.
It's tough. But we need more people to step up. We need you to step up in a different way. You got to stand in it, like our parents, taught us, and we're trying to teach our children. You got to step up and stand in it to make things happen.
Yeah,
I might have taken a long way around to answer that question.
No, you actually, well, you kind of answered my next question about, from a nursing background, and seeing the things that you see in your lived experiences, that was going to be my question. Is that why you chose to run? So you kind of answered that, but tell us a little bit about, because you're so right. And Dr. Lewis says, that goes to get out and vote.
Yeah.
And that is so true. Dr. Lewis has been doing amazing things in our community, trying to advocate for just information out there and getting people engaged. And I really, truly, I know everybody says it's going to be a historic election for many, many reasons. But I really think that this is the time that, this is our time to really make sure that we have diversity of views at the table. I don't want everybody sitting at the table with me at City Hall to think like me. Absolutely. But I do want everybody to have the passion to serve the community and be willing to roll up their sleeves and see other people's perspectives. And so I think that's kind of what you're talking about, is having those lived experiences, having a diversity of perspectives at the table. And I think it's very important, and you can answer this question because I don't know. Do we have anybody in the legislature currently? I think we've had a doctor, maybe in the Senate or maybe a House member. I'm not sure, but or do we have people who have the knowledge there? Because we clearly are living it right now. That if you don't have people making policy that understand the science and don't believe the scientists, those outcomes could be really detrimental to us. So tell us about kind of what went into your thought process to run and why now?
Yeah. So so it wasn't easy, and that's what nothing likely in our lives are easy, right? But it wasn't let me just go run for office and it's time to do this. I had folks talking to me, and it wasn't in a long period of time. I had one gentleman, a white male in the local Democratic Party. I started volunteering in the Democratic Party because I just was kind of feeling uneasy, and I thought, just let me go do something, because I just want to see if there's something that I can help to bring about change in South Carolina, because that has been my path for a long time. So I started volunteering and asking questions. I didn't know a lot. I voted all the time, and saw some people doing some great things, but I was trying to learn more. And he said to me, you ought to think about running for office. And this probably was back in September, October of last year, early, late September. And I say, you've lost your mind. No, absolutely not. No, not me. The next thing I know, I read the book, Oprah Winfrey's book, that's A Path Made Clear. And any female who hadn't read it, please read it. It's not a hard read. And I actually was listening to it while I was doing some planting in my garden. And Oprah started talking about when you're at this place where you start to feel uncomfortable, something you're looking, you're searching, you're feeling, you're asking. Because I was asking, is it time for me to roll up my suitcase and go home and retire and figure out, have this great time with my husband? And I was trying to do that, but that didn't feel like, that's not what I'm supposed to do. So I read that book and I said, okay, well, God, you must have something for me, and I'm just going to wait for the answer. Next thing, I went to a nursing conference. It's a national nursing conference in Washington, the end of October of last year. And Lauren Underwood was the keynote speaker. She is the congresswoman in Chicago, a young nurse who won in 2018. So after she gave this very moving talk, there were people who got up and they were giving her all these accolades about how great she is and how proud we are. And oh my, this is great. Lauren is going to save the world. And she literally said, wait. There is nothing special about me. I answered the bell when it rang. All of you guys in here, we're nurses. This is what we do. Anybody in here can answer the bell. If the bell is ringing, answer. If it's your time, do it, whatever that means. And literally, I was like, she is so stepping on my toes right now. So I had that happen, read the book, and the conversation about you should run was just saying, Laura, you should run. And then COVID happened. And I was one of those people with some colleagues at DHEC and some others in Charleston and across the state that we had been talking about. The DHEC did not reinvest after the recession in 2008 and 9. There was not a reinvestment in our public health system. And see, when you know that public health, where we work, live, and play, that those health systems should run in the background very quietly, nobody knows about it until all of a sudden it doesn't work. Now, when it doesn't work and when it's broken, it's a problem. So that's what I knew when COVID, I'm like, we are nowhere ready for this. And so I found myself sitting at home thinking, maybe I should have done something differently when I knew, when I was just talking about it, maybe I should have done something differently. But then I said, obviously this is my time. I'm being called. This is my time. I talked to my husband. I talked to my brothers and sisters. I'm the youngest of 6. And so we're like a pack. So one's in, we're all in. So I talked to them, and I really had to do some soul searching and a lot of prayer. And every night I went to bed and I said, God, you're going to tell me when I wake up in the morning why I can't do this. And the next day I got up and it was still there. Well, why can't I do this? Why not you? And then one of those things that I probably have always had is Gandhi's message of be the change you want to see in the world. If you're looking for the change, be a part of it, not just talk about it. And here I am. I mean, wow. That's the story on the why. Sometimes I still say I'm a little crazy, but then I meet people like you who inspire me because how you get all the stuff done that you're doing, but you're still there trying to make these decisions and do more and really work hard in the community. And I meet people like, when you're trying to raise money and I make a call, I have a call and some people are hang up on you or, you get the mean, but then I get somebody who's like, wow, thank you for doing this. Or, I'm with you and you're doing good and, keep going. And so then you just keep going in another day. Every time I seem to get a week back, and I want to give up, God gives me something that keeps me going the next day. And that's what it is. Yeah.
So what's been the, I guess, two sides of the question. So what's been the thing that has surprised you the most about running for office? And what has been the best thing about running for office?
Probably the surprise and the best thing, they're both the same. The surprise has been so many people said to me, you've been preparing for this all your life. Like I would call people and say, guess what? You aren't going to believe this. Are you sitting down? I'm running for office. And they're like, oh, I'm not surprised at all. You should have done that. So I've been really surprised by the support that I've been given and the encouragement that I've been given. I've been struck by, because it takes money to prove that you're a serious candidate. I didn't know all of that, but I've been surprised that people have been willing to support me, not just give me encouragement, but write me a check. That has been surprise, and that has also been such an encouraging journey. So the surprise, and what would you say? The surprise and the
And the best thing. So
the best thing, yeah. The best thing, honestly, is meeting people like you. The camaraderie, the people who have great hearts that are kind of in this too and doing it for the right reason. I didn't anticipate, not that because I like people. I mean, I just love doing, and I think that's why nursing works for me. I love people. I love talking to people. I love sharing with people. I love being around people. But it's the outpouring of support and people who like, I am with you and I'm going to help you. What do you need? Let's do this. That has been really surprising, but great, but just super great. And my husband has been pretty amazing as well. So I've been married 30 years in January. Who knew it would last 30 years, but that has been, so my family and the support, that has been pretty remarkable as well. Yeah.
Awesome. Well, my husband and I have a show called Date Night with the Divines where we interview other couples to learn from them. So y'all at the 30-year mark. We need to get you guys on there.
And we met and married. Well, we went to high school together, but we didn't travel in the same circles in high school as at all. And at our 10-year class reunion is when we were reintroduced to each other. And we met and married in 6 months. And then 30 years later, here we are.
Oh, wow. Yeah.
And the funniest part, because when I was telling my mother, I'm like, I think I'm going to do this. I'm kind of, and my mom was like, I was like, what do you think? Because 6 months, that's kind of quick. My mom said, try it. Who knows? Really? But he's pretty amazing. He's amazing.
Cool. Now, how has he liked this whole campaign part? I mean, I think it's tough on the candidate, but it's tougher on the candidate's family.
When I first brought this to him, he said, please no. please no. But I think what happens though is your husbands, right? Those people, they will rise up for anybody who says anything mean or does anything. So anytime that it's been tough and I'm getting nervous about it and I don't think I can do it, then he will say, you are good enough for this. Don't doubt yourself. And then he'll start kind of getting in and doing something to help to, let me know that he's with me. And then when he feels like I have my solid footing again, he kind of backs off again. So that's how it is. Like, I don't want any part of that. And then the next thing he's asking his friend, hey, my wife is running for office. You need to send her a check. Okay. Don't get it in the mail tomorrow. I'm like, okay, yeah, that's what I need, a check. So he's been amazing. Yeah.
So Debbie, what are some of the policy things when elected? What would you like to champion at the South Carolina State House?
Healthcare, right? Mm-hmm. Let's start there. I want to take this. So if I'm elected, certainly I will be serving in a time when we still have to deal with COVID. So we need to follow the science. We need to make decisions that it's good for the entire state. We need to stop this madness about don't wear a mask, or we need to put our economics and land it solidly in public health. And we need to look at what's the good of that decision around everyone. Now, I'm not saying what we don't do or do. We need to make sure that we know what those things are and we need to make every decision around that. I want to see everyone have access to healthcare. If there are folks who have some better ideas around how we do that, I'm willing to listen. But let's talk about how we get there, not let's talk about what we need to call it or whatever, all those things. Let's just get to a healthcare system that can serve every constituent in this state. I care that there's no longer any little boys and girls in our state who has a journey that was like mine, that at some point in their life, they didn't believe that they could do it, that they didn't have the support of everyone in their community and their schools and everything, that they could serve and get to the point of where they want to be, and they could dream and dream big. Mm-hmm. There's no reason our public school systems should always be at the bottom of the list. And it's time for South Carolina. We no longer accept that. I think right now we're in a place of disruption, and in a place of disruption brings on change and positive change. I am so tired of hearing about going back to school. We need to go to the new school or the new system or whatever. We can't continue to go back. So what does it mean? Well, how do we get to ensuring that every kid is reading at whatever the marker is, what the outcome is, not what we need to do to do it in an old system? We need new systems, right? We could have been working right now in getting more teachers helpers, student aid, I don't care what we call it, so that every child does not fall behind, but families are safe, right? Those conversations have to stop happening in silos. We need to bring those conversations back together. We were just working on, from my perspective, a program to look at using more advancements in virtual healthcare, and not moving back to what we used to go, but how do we go forward? This is a new technology. We got to figure out how we use it, disrupt it, and use it wisely so that everyone can have access to it. So schools need to happen and serve everyone, and we need to have as the goal and the outcome that we're in the top 5, top 10 by when. But let's do it. So those are two things for me: economic advancement, and meaning, yes, we need to have access to jobs. We need to have schools that get people to the jobs that they want and need and they're comfortable with. I do think that we're getting to a school system where we're saying, okay, you can, the technical job, and everybody doesn't have access to higher education. Higher education is important. We need that. We need people who understand higher education, and how do we get a reasonable system of making sure that everyone can get there, that they're prepared to get there, they can compete while they're there, and they can afford to be there. So those are the things that I want to talk about. And of course, I live in the suburbs, and I drive downtown every day, and it sucks. And when we were all, can you say suck as a?
Yes. Yes, I've probably said worse. So yeah, you're good.
Okay. That we have to do something to ensure that people can get to work and get back home to spend time with their children, and not all the lost hours that we see that we're wasting, in traffic, 2 hours and 3 hours. So that's where I want to start. And I'm sure that there are other things that people like you and other colleagues will have great ideas on. And yeah, I'm open to that. But we have opportunities that we can, if we would just pay attention and listen, and we would look for those areas where disruption can help us grow and not take us backwards. Yeah.
I will say, I love how you said, and that's a start, and there are other things, because what I think is sometimes people go in with kind of an agenda, and they're like, this is my agenda, this is my agenda. You don't realize really your agenda is dictated by the needs of the community and what, where things are. You might go in thinking one thing. And when I first was elected, my I mean, I had several, but one of my primary issues because of lived experience was um, to work with the domestic violence, how we dealt with domestic violence in summary court and with the police department. And, but that's such a limited issue. I mean, that's a single issue. You can't be single issue. So I love the way that you have your 5 issues. That's a start, but there are other things. So let me ask this. So go
Sure.
to this. So you had a primary and now you have a general, right?
Yes.
Okay. And so people always ask, okay, well, what's she running for? What's she running? So you are running for it's currently a open seat, but you're the Democratic nominee, and then there is a Republican. Is that
That's
correct?
That's
Mhm.
correct.
And the seat in the past has been held by a Republican.
Yes, but he has not had an opponent in 15 years.
Mhm.
Um,
And
yeah,
And
go
so,
ahead.
and that's the thing in South Carolina. I mean, there's a new poll or new, I think it's a poll came out either yesterday or today that talks about how South Carolina is in play for the Senate. Jamie Harrison, who is running an amazing campaign and is showing people that, he really, a Democrat can win statewide and be very successful. And I love the fact that, obviously it's bothering people that he's raising money because they've got all these attack ads about the money he has. When before they used to always say, yeah, Democrats can't raise money. And,
Right,
and he's
right.
showing it. But for you, from what I've done and, what my conversation with you and what I've seen, it looks like, although that seat has been held by a Republican, it is very much in play for you as a Democrat. So can you speak to that a little bit? Because I think sometimes I hate it, but I think sometimes people feel like, oh, I want to support this person, but they can't win. And they give themselves, I mean, I go back to Barack Obama, that very first 2008 election. A lot of folks they liked him and they loved thought that maybe a Black person could be president, but they didn't think a Black person could be. And so they didn't allow themselves to think bigger. So what do you say about, that where people feel like, oh, I like her, but a Democrat can't win that seat?
Right. So a couple of things I want to put, and maybe let me come back to that part, to something that's in my head that I want to say. Don't let me forget.
Okay.
So this seat, it's district, South Carolina Senate District 44. Again, it's been held by a Republican for about 15 years. Unopposed, but we have not had a Democratic candidate in this seat. I think it's been much longer than that, and I don't even remember the numbers. However, Joe Cunningham did very well in this area of my district. He split the vote. At that time was Katie Arrington in 2018. There's been 2 House seats in my district that flipped in 2018. We have had tremendous growth. We have 5,000 new voters. We don't know what's going to happen. But Charleston itself in this region is changing. So we had a special election down in the James Island area just a few weeks ago.
Last week? Yeah, I saw that.
So out of
that seat.
So out of the 5 seats that they believe is flippable in the state, 4 of them are in this area, and mine is one of them. So I think that I can win is because the numbers suggest that I can win. That's one. 35% non-white in this district, 55% women. Women want to see something different. We're tired of having all men talk about women. We're paying attention now, and we have been for a while, I think. And I think women believe that we can do it. That's one. Now I'm going to go to that kind of personal. My dad, and I told this story the other day, my father died right before Barack Obama's election in 2008. My dad died a month before he was elected. But during those last 6, 7, 8 months of my dad's life, that's what kept him going, watching what Barack was doing, President Obama, watching what he was doing. And you could go over there every day and sit with him, and he was so excited to tell you about it. He started with, That boy can't win. I want him to win, but he can't win. He's too young. He's just too young. And my father, for me, my father was not an educated man, but it was like he had a full PhD in philosophy. He was the smartest person I knew, the smartest. And he would say all that. And then as more things started to change, and he would go like, "Man, I think he can do it. He's smart. He is making good decisions. He's bringing people in. He's talking to everyone." And my dad was the kind of person that, when I remember as a little girl, when I used to go ride with him, and he would just be waving at people here, there, everywhere. And I would say, "Daddy, why are you, talking to everybody?" He said, "There's nothing wrong with giving people a time of day. There's nothing wrong with trying to understand the person that you're standing next to, sitting next to, even if they don't quite understand you." So my life and my journey is a testament that I can win. Remember, I started as a little girl with people throwing rocks at me because of the color of my skin. I started in a school that I was put in a classroom. I was put in a classroom of people that I was identified as a slow learner, that I couldn't learn because of the color of my skin. I'm a person that's standing today with a doctoral degree in nursing, and the only one in my siblings that have done that, and because of them, and because of the family, and because of my father. So I can win because I'm going to give it everything I got. Now, at the end of the day, if I don't, well, God put me in this place to learn something, to do something, to inspire someone, and then win or lose, I win. But I believe that I will win, and I can win because it is the time to win. So my dad, when my dad was at the end of life, that month before he died, before Barack Obama won, I whispered in his ear, because I knew he was near death. And I said, "Daddy, he won. He did it." That was the last smile I saw on my father's face. If I ever get a chance, I could tell President Obama about that story, I will. And maybe one day I will. But if not, it's still okay. But we can win because we believe we can win. And we're good enough to win. There's no reason why I can't. I've got just as much or more than my opponent. So I'm just here to do the winning. So,
Exactly. And
yeah.
Dr. Lewis says, yes, you can. And I agree with that. And I'll just share with you something personal too. So I used to always tell people when I first ran, and I still say this, but when I first ran, my very first, I had so many people telling me I couldn't win. I was too young. I was African American. I was a female. I didn't come from a political family. I was challenging an incumbent, and she had a bunch of money and I didn't. And so people were like, "Oh, she's a sweet little girl, but she can't win." And I took that and said, "Okay, they don't believe me. I can show them better than I could tell them." But I also said that what's the worst thing that could happen? If I
Yep.
don't win, I gain a very valuable experience and meet a lot of
Right.
great people.
That's right.
And if I do win, I'm in a position to help a lot of folks. And
Yeah.
so I think that there's something to, number one, of course, not listening to the naysayers, but believing in yourself, because you're the only one who can put limits on yourself.
Right.
But number two, giving it your all with the no fear of defeat. I mean, because it's like, it's not the end of the world if you don't win, but I think taking that fear away from it actually gives you that momentum to say,
Right.
I can win. So
Right.
I definitely believe in you, and I thank you so much for your time. The
Yeah.
last thing I want to ask you, Debbie, tell me, how can people who are listening, well, I want two things. I want you to explain your district so that people know, because although I probably do have a lot of people watching live that are here in Columbia, and everybody knows someone down in the low
That's right.
country.
And tell them to
So
go vote for me.
yes, I want you to tell people what your district is so people know what that is. And then number two, how can people support you or learn more about you? I know you have a website. I know it's Senate District 44, so I'm putting that
Right.
in the chat.
And
And
the website is Debbie for Senate, FOR Debbie4Senate.com. That's my website. If you go on the website, you'll see an email address there, but the email address is also Debbie@Debbie4Senate.com. The District 44 is Lower Berkeley County. So we're talking Goose Creek, Latson, Hanahan. It is all of this new development in Cane Bay, Nexton, Carnes Crossroads. There is also some of the North Charleston and Charleston in the district. So we're in the Eagle Landing near Northwoods Mall area, a Trident Hospital area. That's part of it. And then there's a little bit of Dorchester County. So Lower Berkeley County, Upper Berkeley County, and then a little bit of Dorchester County is in there as well. So District 44. So yes, Debbie for Senate. But and I go back to, I wouldn't have met you if I had not. Well, maybe we would have. Who knows? But to meet you in this environment, and you were one of the very first persons that I was talking to, and the encouragement that I received. So I count that as a huge win. So nurses have been really good to me across the country. They believe that we should have more nurses making policy, that we can work to really have good healthcare in South Carolina and across the country. So I know that I can win, because when I saw how my colleagues were standing up and writing me a check, I said, oh my goodness, this was unbelievable. So people do need to understand. I think that's another thing that we have to educate our communities on. And I don't care if we're talking about African-American community, female community, white, black, white, female, whatever we're talking about. If you believe in a candidate, you have to support them. They need your vote, yes, if you live in the district, but they also need money. That's how our political system it works. We need money so that we can get our message out there. And people have to see you as a viable candidate. So we want people to support us all, but you and I, right? So write us a check. And I tell people, because right now it's a tough time. I get it. Everybody can't afford a lot, but it makes a difference. Those 10, 20, 25, $50 contributions, it makes a difference. So, and I tell folks I say, whatever you can give, I am humbly grateful for it. And if this isn't a time that you can give anything, or if you can give, just say a prayer that if I'm supposed to be here, together we'll make it happen. So that's my message as well. Yeah.
Definitely. I'll tell you, when I was running again that first time, I had little old ladies at church just palming me with $10 saying, just buy some stamps. And you're right, every little bit helps. So
every little bit helps. Yeah.
Well, we are definitely saying a prayer. Let's see. Sonia asked, do you have to live in your district to contribute? No, Sonia, you do not have to live in her district to contribute. You can go to her website. You can give her $5, $10, $25, $100, whatever you can give, because it all adds up and it all helps.
And tell everybody, and tell other people, right? We need your contribution and your giving, and we need you to say, hey, I met this candidate that I think we should support, and here's her website, go give her. And she's happy for whatever it is. Hey, we got great candidates in South Carolina, and check us out and, support us. But no, like I said, I've been blessed that I've had nurses across the country that's been sharing with me. So no, I think, thanks for asking that question, because I think a lot of people think that that's what it has to be.
Yeah, definitely. And I'm telling you that you support candidates that you believe in, like that, going back to that Jamie Harrison thing, that Lindsey Graham commercial talking about, all these people paying him. Lindsey Graham has people outside of South Carolina who give him money too. That doesn't mean that they don't care about the Senate and what happens. And so I'm glad that Jamie's got people outside of South Carolina giving him money. So
absolutely. So, and that's how it works. Right? We're doing. So as soon as you start following the playbook, then the book is wrong, right?
Exactly. I love that. Yeah. So. Anyway, it's been my honor to have you.
Oh, mine as well.
Thank you so much. We will continue to follow you. We'll continue. For those of you, Sonia and others who are watching, y'all share this broadcast so the more people can learn about Dr. Chapman Bryant, and really support her. but we're going to help you get the word out. We're going to help you get elected. And then when you come here to Columbia, all of us here who are in Columbia will be coming to your swearing in. Hopefully we won't be social distancing as much at that time.
That's right.
Be supporting.
And even if it's later on, come and have lunch or something. I really want to learn and see people and hear what people believe and what they'd like to see. So thank you. Yeah.
Definitely. So anyway, so guys, until next time, I'll be here next Monday. Next weekend is Women's Suffrage Week. So I'm going to have some folks on here to talk about suffrage and voting. And Sonia, be here because I want to make sure you're in the part of the conversation. But until next week, I'm Tameika Isaac Divine. Good night and God bless.